Hi, everyone, and welcome. Thank you so much for joining us today. My name is Holly Wingard, and I am with the Training and Technical Assistance Center at the Early Childhood Investment Corporation. And I am thrilled to be bringing you today a webinar and conversation about kinship care in Michigan. I have been blessed over the past several years to be working with my esteemed colleagues, Alicia, Guevara, Warren, and Michele Corey, some of the most amazing and fierce advocates and knowledgeable about all things legislative and budget. And they have been doing a lot of work, and especially it's been ramping up recently around kinship care. And I thought that this would be a really awesome topic to be talking about the needs and some challenges that are happening in our state right now. And so I just want to say thank you in advance to the two of them for taking time out of their busy schedules to come and share what's happening on kinship care and educate us and allow us to be able to ask some questions. So I am going to let them introduce themselves. We're going to first hear from Alicia and then Michele. And so I'll just let them say hello, and then we're going to turn off our cameras so that we make sure that our Wi-Fi stays healthy. So Alicia, do you want to introduce yourself?
Sure. Thank you, Holly. Good morning, everyone. Happy to be here with you this morning to share a little bit about what we know about kinship families and hopefully help everyone learn a little bit more and get engaged in the type of work that's happening across the state to support our families. I am the former director of the Kinship Care Resource Center at MSU. I was there prior to coming on board with ECIC as the director of Statewide Policy Initiatives, and during this time I've actually maintained somewhat of a staff role with the Kinship Care Resource Center. So today I'm kind of wearing two hats, both as a policy wonk with ECIC, but also as staff with the Kinship Care Resource Center. So really happy to be with you all this morning and looking forward to the great conversation that we're going to have.
Thank you. And how about Michele?
Oh, thanks, you guys. I'm really glad to be here too to talk about this issue particularly, and to gather as much information from you guys as I'm sure we're going to be sharing with you. I'm Michele Corey. I am currently the Vice President for Program at Michigan's Children. I've been at Michigan's Children for a long time, more than 20 years. I have been fortunate to have my job be focused on making changes that help improve the lives of children, youth, and families in Michigan. And the only way that organizations like Michigan's Children, which is a statewide policy advocacy organization, can do the kind of work that we do is to understand deeply what's happening with families, with kids around the state. And so our connector with the Kinship Resource Center over the years, with lots of providers around the state, allows us to be able to think a little bit strategically about, you know, what are some of the policy and investment decisions that are required to actually assist this group of caregivers and kids. And so we're going to talk about that today, and I'm really looking forward to having a discussion with all of you.
Thank you so much. So before we get started, just want to do a couple of really quick housekeeping pieces with all of you to help you participate fully. So what you will notice is if in your right navigation bar, I know a lot of people have been using Zoom and we're using GoToWebinar. So depending on which one you've been using a lot, just a little refresher on how to participate. Because we don't have a huge group, this is such a great opportunity to be able to have dialogue. You have two of our state experts about kinship care with you, and so they definitely welcome dialogue. And so there will be a couple of different ways that you can participate, and certainly when they're done sharing the information and setting the frame for us, please feel free. Next to your name there should be a little hand. If you hit that, we'll know that you want to talk, and we'll go ahead and unmute you, and then you can talk with them. Otherwise, there's a question bar as well down there in that navigation bar, and you can just type in your questions and we can all see them, and we'll read those off and address those for you. We do have everybody on mute just to, and we will mute ourselves too when we're not talking, just to keep background noise. We all, of course, are having to give each other grace right now with kids schooling and animals and lawnmowers and wood chippers and whatever else is going on. So we'll work to make sure that we try to keep the sound as good as possible with that. If you have any issues as well, please feel free to type things in the chat or the question box. You have both, and I will be monitoring that and can help you with any tech issues that you have while they're going through the presentation. All right, so I think that's it. Alicia, do you want to take it away? And we're going to turn off our cameras just to keep the power going well.
Okay. Hoping everyone can see my screen here. We'll go ahead and get going here. I'm going to start off by telling you a little bit of the background around kinship care, and then talk to you a little bit about some of the policy things that we've been doing. And then Michelle's going to give us a little bit more information about some current policy opportunities that are happening for folks to engage in. So a little bit about the Kinship Care Resource Center, where we are a community program within the School of Social Work at MSU. And our mission is really driven by supporting and empowering kinship families across the state by providing them with information and resources and referrals to services for caregivers and the children that they're raising, really with this ultimate goal that we want to ensure that children in kinship families are safe, healthy, nurtured, and loved. So it's important for us to kind of start off with the definition of kinship care. It's the full-time care, nurturing, protection of children by relatives, members of tribes or clans, a godparent, step-parents, or really any adult who has some sort of kinship bond with a child, which is oftentimes referred to as fictive kin. So I think about, in that instance, all of us have an aunt or an uncle who's not technically related to us, but we still call them aunt or uncle. But really it's about when kids are being cared for by a relative or other adult who is not a parent. So we want to start off with a quick poll here and kind of try to understand how many of you have either worked with, if you're a service provider, or know someone who is raising a relative's child. You want to take a minute and let us know.
Okay, almost everyone has voted. Give it 5 more seconds.
All right, so it looks like almost everybody or everyone who did vote has either worked with or knows a kinship family. One of the things that we find is that oftentimes people don't talk about being in or a part of a kinship family. We'll talk about some of the reasons why that happens, but it actually occurs much more often than what we actually think. So the data from you all, it just reflects that larger kind of understanding that we have as well. So want to talk to you for just a minute about, how do kids end up in kinship care? How do families find themselves caring for their relatives' children? It can happen, due to a variety of reasons. So if we think about when parents are deployed as a part of their military assignment, you often will see aunts or uncles or grandparents stepping up to help care for those children. When a child's parent loses a parent, they oftentimes are living with another relative. When parents become incarcerated, that often will lead to kinship care, along with things like immigration separations. We've seen an uptick in that over recent years. And then the last one is the area where we tend to focus a lot of our the work around for kinship care is when there's a concern for the health, safety, or well-being for a child, and typically that involves the child protective services and the child welfare system, like foster care, in the picture. So who are our kinship caregivers? More often than not, they're usually grandparents, sometimes great aunts and uncles, sometimes cousins. The other group that we don't talk about as often are siblings. We've seen and heard several cases of siblings coming in and stepping in to take care of their younger siblings. One of the things to keep in mind about our relatives, and we'll continue, you'll notice that there's a theme throughout this, is that relatives are less likely to seek services. They tend to fly under the radar a little bit. And so that's one of the things that we really focus in on as a way to understand what types of supports we really need to put in place for relatives. So you'll see this kind of come up throughout the presentation. So a little bit about kinship caregivers. These numbers actually represent grandparents who are responsible for grandchildren who live with them. So it's not inclusive of the aunts, uncles, cousins, or siblings. But we've been able to, a lot of the work that's been done in collaboration with the aging community has been able to really look at and better understand the grandparents part of this, because they do tend to be the larger group of kinship caregivers. So when we look at households where grandparents are raising grandchildren, about a third don't have any parents present. 63% of them are under the age of 60. More than half are still in the workforce, and over 1 in 5 are living in poverty. And then if we look at, those with disabilities, about 27%, and almost a third are also unmarried. So there are 2 types of kinship care that you'll hear us refer to. First, there's the public or the formal care is what we call it, when a child is removed from their home by Child Protective Services and placed with a relative for care, typically through foster care. There are some instances where a child is removed and placed with a relative and then immediately kind of guided to go through the court system to become a legal guardian, removing them from the child welfare system and essentially pushing them into what would be considered more of an informal care. So on the informal or the private side, when we say no system involvement, that is really referring to the lack of child welfare involvement. But this is usually when parents will either voluntarily leave the child, or they may just leave the kiddo and not come back. So the child is with the relative caregiver. So those are kind of the 2 sides of kinship care that you'll hear us talk about. So either formal care, where you have the child welfare system involved, or informal care, where the foster care system is not engaged in the care of the child. So just to give us a rough idea of the number of kids here in the state living in kinship families, close to 61,000 kids, or about 3% of our kids between the ages of 0 to 17 are living in the care of a relative, according to the National Kids Count Data Center. When we look at that breakdown by race and ethnicity, we see it's nearly 34,000 white non-Hispanic children and about 27,000 children of color. So this equates to about 2.3% and nearly 4%. So you'll see that there's a pretty significant disparity where kids of color are more likely to be living in kinship care, which also is another factor to take into consideration when we develop strategies around outreach and engagement to be able to deliver supports and services to families. So it's really important for us to understand that no matter what circumstance led to a child being placed in kinship care, whether it's because their parent has been deployed in the military, a parent is incarcerated, or they've been removed because of potential abuse or neglect, this child has no doubt undergone a certain level of trauma due to whatever circumstance they endured, along with the fact that all of them have been separated from their parents, right? With that removal, that alone causes a certain amount of trauma. And so it's really important for us to think about how and what types of services are available to these kiddos and the families, and really helping our families understand how to care for and address the trauma that the kids they're raising have endured. We know that there's an increased need for specialized services, and we also know that outside of the child welfare system, so in that informal care, it can become extremely difficult for families to gain access to these types of services. We also know, because there's a ton of research out there that shows that when kids are placed with kin, there are a number of benefits that come out of this. So being placed with a relative can actually minimize and reduce the level of trauma that is experienced. Some of those things lead to improved child well-being, improved behavioral and mental health outcomes. We also know that the chances of increased permanency also happen when kids are placed with their relatives, and oftentimes they undergo reduced numbers of transitions across placements, so they're more likely to stay with that relative for a long period of time. Another thing that's really important about kinship care is that there are many times in the formal foster care system, when you have large sibling groups, they're often separated and not able to stay with one another. But when kids are placed with a relative, that relative will often either be able to care for the entire sibling group, or there are several relatives that might be caring for the sibling group, still promoting that sibling tie. The last 2 points I think are also really important. When we think about youth who age out of the foster care system, or just youth in general, we all know how important it is to have that strong support system, to have that relationship with another caring adult as you transition into young adulthood. So we know that kids who are placed in kinship care actually maintain that relationship as they become young adults, and that is extremely important for them when you think about the level of guidance and support that all of us needed when we were young adults, and some of us still do. The other thing is that when we place kids with relatives, they are more likely to preserve the children's cultural identity, and they're also able to maintain many of those same community connections that they had when they were with their parent. There are, of course, a number of challenges. I've alluded to a couple of them throughout the presentation. There's a lot of hesitancy from relatives to seek services. Typically, this kind of can stem from a lot of different things. Some of it is that relatives feel like it's their responsibility to care for their relative children and that they shouldn't seek support. Sometimes they don't seek support because of stigma or even fear. Sometimes they may be afraid that the parent will come and take the child away if they seek services, or that the system will take the child away from them. So there's a lot of hesitancy on the kinship family side to really try to access the services that they might need. One of the things to keep in mind is there are often some very difficult family dynamics. Usually in a typical situation, you have the grandparent who's dealing with their own child, right? And so this idea that the parent may come in and out of the child's life can cause strain. There may be disagreement about the best way to care for the child. So having those extra layers can really add to some difficult family strains. Another kind of thought is around kind of the changing relationships that they have. So suddenly grandpa goes from being just grandpa to also now being grandpa and parent to the child, and that can often be confusing for both the child and the kinship caregiver. There is a lack of resources, and there are a number of information barriers for kinship families who may not understand all of the benefits that they may be able to actually access. There's also some misinformation on the other side in the system where there's just not a whole lot of information around what benefits they can actually provide to kinship families. And a lot of that is actually due to legal complexity. So when there are, I don't have time to go through this today, but we actually do an entire 2-hour training around kind of the legal side of kinship care, because there are various levels and types of legal relationships that kinship caregivers have with the children they're raising, and that oftentimes will lead to what types of services they're able to actually access. And so there's a lot of kind of complications around the legal side as well. Another area that is a challenge for kinship care is being able to access respite care. So there's really a lack of availability of respite services available for kinship caregivers to be able to really have that break and do that self-care. You have a lot of caregivers who may have already been retired and not expecting to raise another child at that point in their life. And so being able to provide that break that they need is also really important. Another area that is often a challenge is being able to reach informal caregivers. We know the kids who are part of the foster care system through the Department of Health and Human Services, but for those who are living in informal types of placements, we really struggle to be able to reach them, to be able to provide the types of supports that they might need. And then the other side of this is also thinking about the parents, the biological parents, and what types of services they might be able to access in order to be reunified with their child. So a couple of things I just want to mention before I turn it over to Michele is that one of the exciting things that we have happening here in Michigan to really try to address some of those challenges is under the Family First Prevention Services Act. There is language to help states to develop, enhance, and evaluate Navigator programs for kinship caregivers. So MSU, Kinship Care Resource Center, is actually the state's recipient to be able to develop this program. So over the past 2 years, we've been developing a Navigator program with the goals around safety, permanency, and well-being for children in kinship families. The model is really based on information and referral services, service coordination, outreach and training, and then utilizing kinship caregivers to actually staff and be our kinship navigators. So I'll just say that this has been an extremely important piece of the model and the program, is being able to engage kinship caregivers to develop a program that'll work for kinship caregivers. It's also been really helpful because when a kinship caregiver calls our 1-800 number, they're connected directly with somebody who has experienced something similar, and that they can connect much quicker and develop trust a little faster to be able to provide the support that's needed. So a couple of things about what you can do if you know a kinship family who's in need of any type of assistance or information or resources, please refer them to our 1-800 number, or they can shoot us an email. We also do a monthly newsletter that you can also sign up for by emailing us at kinship@msu.edu. If you serve or work with kinship families, we have a number of flyers and brochures that might be helpful for you to be able to disseminate to families. So again, if you email us, we can send those your way. At this point, we're probably doing more electronic, but we could potentially also send you paper copies as well. And the last thing that I just want to mention is that with the support of several partners, the Kinship Care Resource Center, Michigan's Children, several local support groups serving kinship families, Fostering Forward Michigan, we've been able to launch the Michigan Kinship Care Coalition. Our first meeting was in February 2020, so it's a fairly new group that's meeting, but we've done a number of things around advocacy. In fact, we got really great news yesterday that 2 of the bills that I'm sure Michelle's going to talk about actually passed the Senate, and we're really looking forward to continuing that work as a group. So if this is an issue that you're interested in, again, you can email the kinship@msu.edu and we can get you more information about the Kinship Care Coalition. So with that, I'm going to go ahead and turn it over to Michele.
Thanks, Alicia. I just wanted to maybe pause for a second. I know nobody's put a question in the, oh wait, somebody did in the chat about the legal training, interest in that. That's really such a huge issue. Do people have questions specifically for Alicia and this whole sort of underpinning underneath kinship families, or anything you want to share with the group right now about kind of what you're seeing in your own communities around kinship family concerns?
Yeah, I'll just say we had a couple of great comments from Sherry about how relatives don't often know that services are available, as they're often not given any kind of guidance. And the other issues with getting services is that sometimes the care is not a set event, but gradual over time. And she was interested definitely in learning more about the legal training.
Great. Well, yeah, and I think that what I'm going to do is kind of pull us through a little bit sort of conceptually about what we heard, what Alicia said, what you all know who are part of this as service providers, and about specific service needs and challenges of this group, and then kind of moving that into what are some of the policy arenas that we need to be thinking about that sometimes we aren't thinking about, in terms of making sure that things are appropriately accessible, et cetera, for relative caregivers and other kin families. And then, as Alicia had said, a little bit about sort of current conversations. I will talk a little bit more about the bills that were just passed through the House and Senate. So they're likely being signed by the governor shortly to assist kinship families. And as you all know, things don't stop. Even the need for engagement with things doesn't stop even when things sort of go all the way through the process. So we'll talk a little bit more about that later too. I think just quickly, because, you know, Alicia covered so much of this and you guys know so much of this anyway, you know, sometimes it's just helpful to think back through about, you know, we know a lot about what stabilizes families and what destabilizes them. And, you know, in addition to some of the spaces that Alicia had talked about, why kids end up outside of the care of their parents and potentially with relatives or other kin, you know, we know a lot about how that works. And we've known that there have, you know, there's a few things that pull families into like the child welfare system, other destabilizing systems, and you all see it, we know it. So there's, you know, domestic violence issues, substance abuse issues, mental health challenges, lack of parenting knowledge and skill, lack of connections to supports, you know, unstable housing. All of these things are connected to the kind of policy conversations that we have to be having really to support all of the families that we serve. And we need to keep in mind how those conversations are also essential to have in terms of kinship and relative caregiving families. You know, there's clear paths for policy investment and program decisions, but we just don't always make those. Next one, Alicia. So again, and Alicia talked about some of this, you know, what do kids and youth need? You know, they need supportive caregivers. They need connections to their birth families if they have been removed from birth families. There's just lots and lots of research and, you know, pretty much common sense about that. There's been a real trend, a lot due to some federal leadership that Alicia had mentioned, and federal leadership before that, to really to develop a preference for family placements and kin placements when kids are officially removed, and for obvious reasons. Caregivers, however, need to be trained in trauma. They need to be supported. Kids need consistent and normal environments. So there needs to be, you know, circumstances where they're not moving from one space to another, inconsistent placements, and they need timely services. There's plenty of evidence, and again, sort of common sense, that many kids that are cared for by relatives and aren't being cared for by their biological parents have much more complex needs. They're often really dependent on other under-resourced systems like we were talking about early on. So early intervention and diagnosis, child care systems, mental health services, those systems are all themselves under-resourced. And they're also dependent on a lot of systems working well together, right? And again, this isn't unlike lots of families that we serve, but it's just another layer. So to make sure that the health system is working with the education system, is working with the workforce system, you know, it's complicated. And then we also talked about, and I can't believe I didn't put it up here, frankly, just the complication of the legal system and how much legal assistance is actually needed for kinship caregivers as well to really navigate the options and figure out the best space for the kids that they're caring for. And as Alicia was talking about, and as you look at what kids need, there's obviously a clear advantage for kids to be with kin, to be with people they know, to be with their families. But the increased needs of a lot of these kids, it's a lot to place on anybody. It's a lot to place on grandparents and aunties and siblings. They have much higher incidence of mental health and physical health needs, disabilities, delays. And as Alicia had mentioned before too, many caregivers are still in the workforce. They need childcare, they need respite care. And then we have this added complication that we were just talking about relative. So this is a complication for us, right? For service providers and policy advocates, that relative caregivers are less likely to access services when many are more in need of them. And you know, we just have to really struggle with that and think about how we're actually increasing access to services for those groups. Go ahead and go to the next one. So if you think about specific policy implications, you know, there's, I don't know, I'm only struggling because it's so frustrating to me, that despite what we know about what stabilizes and destabilizes families, we still fail to invest in much of that. And frankly, the use of relative care and the support of relative and kinship care is one of those research strategies for family support. And as Alicia had said, it leads to, frankly, it helps with reunification in a lot of instances where, you know, you just need a little bit of help for a little while and the kids are more likely to be able to be placed back with their parents with the help of their relatives and kin, and just precludes a lot of the issues that happen. So anyway, I'll stop with that. But we failed to invest in lots of the preventative spaces that would actually maintain stabilization for families. There's obviously a lot of training and support that is necessary, and policy needs to support that. So some of that, as Alicia was mentioning, you know, there's the Navigator programs and really, you know, clear and robust support networks. Some of that is going on. Some of that has not been supported in state budgets. And so, you know, there's just a lot of training and support that's necessary. And this whole point about really digging into how are we really supporting informal kin and how are we supporting all types of relative care. One of the ones that Alicia had mentioned is siblings. I think that many sibling families that end up in foster care, the oldest siblings are really committed to trying to take their younger siblings out of that care and support those siblings. They are very often very fragile themselves and need significant support for their ability to really be able to do that. And then obviously there are unique needs for older caregivers, housing needs, unique health needs. You know, over the most recent times, serious increased COVID risks and worries that obviously need to be provided. There are ways to use the child care subsidy to better serve relative caregivers. You know, we talked a bit about, Alicia talked a bit about just the need for respite care and the idea that we need to think through the reasons, some different reasons for why people might need a child care subsidy to work. There are, you know, the initiatives like the infant early childhood mental health consultants for child care providers are really important to this population, to any population that is caring for children and youth with significant needs, significant mental health or other behavioral issues, which are just much more pronounced often in some of the issues and needs that relative caregivers are dealing with. There's obvious issues with early intervention services and the need for early diagnosis and treatment, like early on. And, you know, we can all talk about that, the inconsistencies of that kind of program and effort around the state of Michigan. Clearly timely and appropriate access to behavioral health services. Again, those services are not always consistently available and accessible. And as we were talking about before, for probably a multitude of reasons, relative caregivers don't always access them, even if they could, for, again, a number of reasons. Clearly improving trauma-informed practice is a huge issue and a huge benefit to relative and kinship care families in all systems. And then the idea of targeted education system resources, again, for identification, assessment, and services that help to catch up. And some of these, you know, what Alicia was talking about too, the sort of transitioning spaces for kids, we just need to pay a little bit more attention to that and make sure that the education system is well aware of the needs and specific challenges and ways to assist with relative placement too. I just want to stop for a second right now to just ask the question of you all of, you know, what else, right? Like we had talked about the relatives not knowing about services that are available to them, the real serious issues of legal needs and other things for relative caregivers. You know, are there other things, other pieces of this that I'm not bringing forward that you would really bring forward and see as critically important? I just want to make sure that we have an opportunity to do that if people have some thoughts there.
So
and I guess with it too, Holly, you know, you guys have done a lot of caregiver, you know, parent surveying and lots of different conversations too. And if other things have come up in some of that other work, I mean, it's helpful for us to think about this total picture too.
Mm-hmm. Absolutely. So I'm seeing a couple things in the chat. One of them says that, you know, one thing I've recently run across is school support for children who are moving between schools frequently, and they're homeless because they're moving between family members, but the disruption's hard because this time the movement will be permanent, quote unquote. And then how to access community resources when the relative is able to get health care for their child when many services are only for children on Medicare.
Mm-hmm.
Yeah.
Yeah, no, those are super important. I think that the healthcare issue is a huge issue, and I mean, it feels like that's one that is completely doable, right? I mean, we could clearly try to think about some shifts in Medicaid coverage or other things where we would provide better connections to coverage for kinship families. I think that that's a perfect example of a policy space, right? That's something that could be assisted. And there are huge issues around, obviously, around kids moving from place to place and kids moving from family to home. One of the things that I know many relative caregivers face is this sort of back and forth themselves, and this is part of the complication conversation, I think, that Alicia was having before, that, you know, family dynamics are complicated, and at times, you know, just what you're saying, relative caregivers are like, okay, so we'll take them, then they go back, then we take them, then they go back. And, you know, honestly, so much of all of that is that there aren't adequate supports for birth parents to maintain stability, and there aren't adequate supports for relative caregivers to be able to navigate that as well. And there's huge issues in the education system around just understanding who these kids are and providing some targeted supports for stabilizing their education space as well. Alicia has heard me say this lots of times, and I'm not sure how this plays out with kids in kinship care, but for kids in foster care, they just have the worst outcomes of anyone. They have poorer outcomes than homeless kids. They have poor educational outcomes, poorer outcomes than you know, migrant kids, poorer outcomes than Black kids, poorer outcomes than Native kids. It's just that the outcomes are startlingly bad in education. And, you know, we really do need to spend some more time focusing in on those. But sorry, I'll get off that soapbox. I think this slide is just about, you know, what you guys know. So this idea of information plus research and evidence plus lived experience, and I think lived experience by relative caregivers themselves and lived experience with the providers that are trying to serve them well is what really leads to good public policy, investment, and strategy. And so, you know, part of what we're really trying to do with the Kinship Care Coalition, with, you know, connecting to providers like you guys, connecting to other partners, is to just make sure that as we are thinking about where do we go in, you know, real policy and investment, that we're incorporating what's actually happening. And frankly, it's not an aha moment necessarily, but one of the things I'm thinking about even in this conversation is just the underlying sort of lack of access and lack of service requesting even, and that's something that we really have to wrestle with a little bit more. Alicia, you want to go to the next one? So I was laughing when I put together the slide, because I'm like the worst slide putter together, right? Like, look at all these words on the slide. It's just really, but anyway, I did want to give people a sense of sort of currently what are we talking about. So I guess I'll go to I sort of have this at the beginning and the end. The committing resource to the Kinship Navigator and Kinship Advisory efforts. So these are the bills that just got passed. Two bills that were a couple legislative sessions in the making. One that is really putting into law the idea that we need to have a robust Kinship Navigator program. We currently have federal resources to support that, but the point is sort of we might not always, and we need to actually have a state level commitment to that. So that was very exciting that that passed all the way through the legislature. These bills were very bipartisan. There was hardly any dissent on them. So there's a real commitment, I think, on the part of the legislature to try to understand what's going on with these populations better and to try to understand how to assist them. So, I mean, that's a great place to be, right? The second bill that went through actually creates a Kinship Advisory Committee within state government. And again, it's sort of this point of we need to understand more about formal and informal caregivers. We need to understand more about what their challenges are, and we need to build policy and investment strategies based on that. And that Kinship Advisory space is an official space to really be making sure that the legislature and the administration maintain some focus on this population and really try to set up some real recommendations to move forward. And but so this is a huge success, truly. Many kinship care providers, many agencies, many allies were really involved for, I don't know, I would say the last 4 years probably, in trying to help legislators better understand the need for these things. You know, it was a great advocacy story. We were successful in having a statewide relative caregiver capital day last fall, which was just great. And we were able to talk to lots of legislators and saw lots of concern and all of that. And so that really culminated in the passage of these bills. However, as you well know, for example, to actually have a kinship advisory space that does work and works toward what it's supposed to do, it actually requires an appropriation. So it requires some funding. So now the next step for that is, you know, Michigan's Children and others talking to people on appropriations to try to figure out, making sure that they're also committed to the resources necessary to make these things happen. So as always, you know, it's a great success, still needs some attention, still needs some work. And I think that it's really one of those areas where people can still be very helpful with their legislators in terms of just continuing to talk about the importance of this population and helping them understand the importance of really supporting these sort of additional information and collaborative spaces like the advisory committee. So that's a great space to be involved. obviously, so I guess I don't want to complicate this too much, but last year there was a court decision that said that even if you aren't a foster care provider, but you're a relative care provider, that is registered, that is in the child welfare system, so not informal caregivers, but caregivers that are in the child welfare system, but not necessarily licensed foster parents. Those caregivers are also entitled to a foster care payment as if they were licensed foster families. And that happened pretty recently. And one of the things that we just have to keep talking about is that that space needs to continue to be funded. That the state needs to continue to match federal dollars to support those relative care providers, even if they're not licensed foster parents. I had said before, there were actually a few things that were vetoed in the current year's budget, so this last year, that were supportive of relative caregivers and need to be put back in the budget. I mean, this year's budget is a whole other story, but that doesn't mean that we can't continue to talk about what's necessary. So the Adoptive Family Support Network supports all types of families, adoptive, foster, kin, birth, and their work was actually vetoed out of the budget last year. Relative caregiver incentive payments, so those were incentive payments for caregivers to become licensed foster parents, was also removed from the budget last year. And a support for court-appointed special advocate expansion, and CASAs are often a great support for relative caregivers in the court system. And as we were talking about this need for legal support. And then of course, you know, this year with this crisis budget, we need to really keep talking about retaining funding for things that are likely at risk now. So things like early on, where we had finally gotten some traction for some moving upward state investment in early intervention programs, that's truly at risk now. Expanded home visiting opportunities, access to prevention programs, family reunification, caregiver support, you know, all of that stuff just needs to continue to be discussed as critically essential as we talk about where we're going to place state resource. Some of the childcare efforts I think are really quite interesting and wonderful. As we had talked before, you know, there are different things that we could be doing with our childcare subsidy system to better support relative caregivers, and that needs to continue to be part of that discussion. And again, all of you all that provide great services to relative caregivers have a good sense of how that service might be improved. So I guess I'll just stop there. I don't know if anybody has any questions, concerns. You can obviously, and I'm sure Holly will say this, that, you know, Alicia and I are here for any follow-up concerns. If you want to get more involved in things like the coalition or, you know, other advocacy efforts through Michigan's Children and elsewhere, we obviously are thrilled for the connector. So.
Thanks, Michelle. So there is a question about, what does CASA stand for?
Sorry, don't you hate that when people do that? We have these 2 new interns and we're having the staff meeting and the interns are like, what are you guys talking about this entire time? So the court-appointed special advocates are CASAs, and they are independent advocates that work in the court system to sort of represent kids in the court system. They're not attorneys, but they help kids and families kind of maneuver through some of the court system spaces. They're not actually actually available in every court system around the state. So it may be that you don't have a CASA in your area too. But it's just another sort of assistance space with that, with court issues, with legal issues. And it's a national model. They're well trained, you know, it's a great group.
Thank you. There was also a comment a bit earlier about the importance of referrals in the substance use programming as well.
Absolutely. And, you know, just like, I don't know, you know, just like mental health services, substance abuse services are just few and far between, and accessibility to those services. I'm always surprised at even kids in the foster care system, how many young people get removed because of their own substance abuse issue. You know, I mean, it's a huge issue. And we need to, I appreciate that point. We really need to be doing some true advocacy around access to those services.
Mm-hmm. So I'm not seeing any other questions typed in. Please feel free to raise your hand and we can unmute you if you wanted to add any comments or thoughts or ask any questions. We're certainly interested in your thoughts.
I think one of the things that I didn't mention, and I won't call Meredith out, but but there's a lot of just amazing practice that happens in the tribal settings that many of the rest of our communities could learn a lot about. And I think really thinking about how some of the indigenous groups in the state just think about families and kin and prioritize families and kin and support families and kin is something worth saying.
Absolutely. Thank you. And she's thanking you, saying me wetch. Meredith, I'm never sure if I'm saying that quite right. Sherry is also asking, is the advisory group still currently meeting?
So the Kinship Care Coalition, this is, I think I just confused everyone probably, right? The Kinship Care Coalition has been, and Alicia can talk a little bit more about this, is a sort of outside of government conversation about this, and they are meeting, and we are excited to have additional people join us on that. The Kinship Advisory Group that was just passed in legislation will be sort of more of an inside group. And that's, you know, we're hopeful that the coalition itself can help move some of the directions of that internal group as well.
Yeah, and I'll just echo what Michelle just said. That's exactly right, is that we have these two different bodies kind of happening simultaneously. So with the legislation, there will be this creation of this advisory council or committee with some designated folks to be a part of it, because one of the goals is, you know, it is about understanding better the needs of kinship families, but also to better coordinate across various departments. So if you look specifically at that legislation, it's like department heads from like Department of Health and Human Services and others to be able to work together across that. And then I would think of, just as Michelle said, the Michigan Kinship Care Coalition is this outside external group really working both in a couple of different spaces. And one of them is kind of the advocacy space to apply some of the pressure on this advisory council eventually, on legislators and others to be able to make things, you know, better based on what we know. One of the things to note about the Kinship Care Coalition is that and we've alluded to this a few times, is that many of the members and the leaders in this space are actually kinship caregivers. So really helping to drive a lot of the things that need to be done in that space. So of course, if you are interested in being a part of that coalition, we would, you know, love to have you. We like to ensure that we have a lot of different perspectives perspectives and voices represented. So feel free to reach out to either me or Michelle, and we can definitely get you connected to that group.
That's great. Thank you. And so I see there is a quick question here about if this is going to be available. I have been recording it, yes, and so we will upload it onto our Training and TA webpage at the ECIC site, but also please feel free to email me or Alicia, since her email's up there, and we can send it to you, of course, too. I know that this conversation really is intended as one of many that we need to continue to be having, and really keep pushing this towards the forefront about how critically important this is for many young children and families, and whatever family looks like for kids in the state of Michigan. I just want to say thank you so much, Michele and Alicia, for your time today and your expertise. Really, I've learned quite a bit, and I'm sure everyone else has. And I think knowing that everyone knows, works with, or is potentially a kinship caregiver themselves, I'm sure it's always a good thing to be able to be validating and joining forces and moving things forward. So thank you, everyone, for your great participation, and we look forward to more conversations. Thank you, ladies.